Welcome to Leo Live on Monday, and we have Nicole Jorwic from the ARC in Washington to give us some updates as well. So thanks all for joining us, and we'll take questions probably at the end.
Well, I'm going to ask.
All right, why don't you go ahead?
So Nicole can leave. It's crazy time, so I'm skipping over even the introduction when I do the virus, and I know I can tell you, everyone, that the virus is sort of, the college students coming, it has gone up a bit, but we'll get to that later in the meeting. I'm really pleased to have Nicole with us. In fact, before she starts, I do have a federal facing the facts slide here that I want to show everybody, which, I shared with you last week, because this is going a distance. We really have to go the distance in our advocacy. And there's a present deficit, there's the unresolved. And when I talk about the present deficit, I'm not talking about the federal one. I'm talking about our state one, because obviously they can print paper, right, Nicole, in DC? And the unresolved DC negotiation, the mixed messages from the White House, the unknown impact of a second surge. Our public systems are stressed, private businesses are reeling, transportation unclear. And besides our issues about long-term support services, the whole school routine issue is really for not only kids with special needs, but other kids and youth. It's overwhelmed families across the state and nation. So with that, very optimistic outlook, but that's why we have to advocate, because we've got to be heard, and that it's pretty serious out there. We have Nicole Jorwic with us, who's the Senior Director of Policy at the ARC, and she's a great colleague. She's nonstop, and the team at the ARC is nonstop. I really continue to have the utmost respect for them, and she's going to talk to us. And Nicole, if you want, I also have that chart you sent us on the CARES Act versus the HEALS Act. So if you want that shared, let me know.
Okay.
And further, here she is to tell us what the heck is going on,
Yeah, hi everybody. And I'm actually back home in Chicago again. So I'm going to go outside so that I don't get interrupted by my nephew or my brother. Glad to be joining you. Wish I was joining you with different news. Definitely we're very disappointed when the Senate decided last week to adjourn for recess without passing a fourth COVID legislative package. We, as a bit of a refresher, I know I've been on with you all before, but as a bit of a refresher, the House of Representatives did pass the HEROES Act on May 15th. So almost 3 months later, on August 13th, the Senate adjourned without even taking that bill up with a vote. They did come out with this in the Senate, the HEALS Act that was introduced on July 27th or 28th. It did not include the majority of the issues that we've been working on. The top priority issues that we've been working on in DC is the dedicated funding for home and community-based services that was included in Section 30103 of the HEROES Act, access to PPE or personal protective equipment, ensuring that stimulus payments don't have barriers for people with disabilities, and ensuring that paid leave is available for all folks. That doesn't mean that's the only things that we're working on. Those have just been the priority issues that we've been including in our action alerts. And so we were really grateful when the HEROES Act did include the majority of those issues. It included fixes for ensuring that people with disabilities who were declared dependents would have access to their stimulus payments. It included, as I said, the HCVS funding. Obviously, to be quite frank, and to also be honest and say thank you to everyone who has been working really hard. I've heard from both sides of the aisle in the Senate and the House that the issue of home and community-based services has been extremely understood, and they're really ready to kind of take action on it. It's just kind of unfortunately stuck right now in this big P politics and the big quagmire that's going on. Part of why we believe that the Senate didn't act was because, as folks might have been seeing on the news, the negotiations that were going on for the fourth legislative package were happening between the House leadership, so Speaker Pelosi, and Representative McCarthy, as well as Senator Schumer. Senator McConnell, who's the majority leader in the Senate, was sitting those out and instead relying on the White House, and said that he would put to the floor anything that they came up with. Unfortunately, what ended up happening was that the White House walked away from the table and decided to do these executive orders that don't touch on the majority of our issues. They touch on some of the issues that were kind of, again, stuck in that political quagmire, including unemployment, student loan benefits, rent moratoriums, and also the payroll tax holiday, they're calling it. What those executive orders do and do not do, or what the authority for those are not things that I will go too much into. I will just say that we've seen that states have already declined, for example, to take up the executive order because it would require around unemployment, because it would require the state to come up with 1/4 of that money. And so it's really, really important. I know that I've been saying this, unfortunately, since March, but it's extremely important that especially senators are hearing from you all. I know that you have 2 senators that do understand the issues, and both Senator Markey and Senator Warren were on a big letter that we were really happy to see that came out the week that the HEALS Act came out, that called out the fact that there was no funding for home and community-based services. That was signed on by 42 senators, so that was a really good showing. And I think, again, kind of points to the fact that this has been a well-socialized issue, but unfortunately, that we have to continue to be loud so that when they do come back, that the pressure is clear that they need to act. Because the other thing to remember that we have out there on the horizon is that September 30th is when the current continuing resolution or appropriations and funding for the government ends. And so they're not coming back at this point. The House might come back for an emergency session over the weekend, but that's specifically around the post office. And again, it's the Senate that needs to act. And so we don't anticipate that the Senate will be back until after Labor Day. And it's extremely important that they get back to work. We are sending out those messages. We'll be pushing out big action alerts. We're extremely frustrated. I think there's no positives in any of this, but I guess from a team perspective, it's the first time that some of us are at least going to try to take a little bit of time off so that we can hit the ground running. We're very deflated that when there was an adjournment without a package, especially because we did hear such good things about where our issues were falling. But we will just continue to push when things come back. So I don't want to be anything but positive about how things will go. We're just, again, kind of stuck in the mess. So I'll stop talking there and happy to take any questions.
That was great. Nicole, 2 things. One's a question, one's just a statement. Thomas Edison, and we know he was a persistent guy, an inventor, but he said, the worst thing you can do is to stop trying again. And for us and for you and for the team, so thank you, number one. So I'm going to look up that direct quote so I can put it somewhere, because I think sometimes our constituents, whether they're persons with disabilities, family, siblings, mother, father, people feel like, oh my God, I got to keep doing this. And the true answer is yes, even in good times, we have to do it. And it's usually the 20% that do it for the 100%, but it's just so important, and 20% is not bad if they hear from 20%, but we'd like it to be higher. The question is, they never took the package up, even for a vote, because working with the president with these sort of, extension of presidential power, really, when you step back and look at this, it's scary. They blamed Barack Obama for extending presidential power. And this has got to be sort of like Thomas Jefferson blaming Washington for presidential power when years later he ended up, doing some pretty aggressive stuff, as president, the Federalist stuff where he wasn't a Federalist. So what was the rationale? Because they decided to work with the president so they don't need to even show the public that they passed the bill in their branch, even if it was different.
Yeah, I mean, why they didn't put up to things
were they scared of the vote? Were they scared there'd be a close vote that they might,
Probably. I mean, historically in Mitch McConnell's leadership, he does not put things on the floor that he has any concerns about one way or the other. He kind of knows where things are going to go if they're going to go to the floor. And I do think that we were seeing, this isn't conjecture, this is from talking to the offices that I have relationships with on both sides of the aisle, but there are a lot of, we do have an election coming up in November, so without being political at all, but the fact of the matter is that there are a lot of Republican senators that are hearing the same thing that Democratic senators are hearing. And so there was pressure, and frankly, it came down to money. As the slide I know says, the HEROES Act was over $3 trillion. The HEALS Act was $1 trillion. Frankly, $1 trillion is not most likely enough, and even the components of the HEALS Act weren't what we would have wanted to spend $1 trillion on either. There were liability protections in there that are really troubling and problematic for the ADA, et cetera. But I think that what it came down to, it was a gamble. It's a gamble. It was a gamble that the executive orders would make it look like the administration is responding. I think we are, as I said, we're seeing that states not taking them up are going to show that that's probably ineffective. And the Senate was taking a gamble that they will not get the receptions that I know and I can see that they're getting when they go home. And so it's really troubling. And we know that there are small pieces like the Provider Relief Fund and things that will hopefully be able to get some funding down to service providers, but we also have to make sure, the biggest thing that we've had to make sure is that there's clear understanding that the HCBS dollars are about supporting providers, but it's also about supporting the integrity of the Medicaid HCBS system overall, which is obviously an extreme threat because of what we know is going to be coming with state budgets, et cetera.
Right. Wow. Okay. And Chris asks about the Hastert rule applied to the Senate issue of control. Was that why that rule was applied to control their colleagues and Democrats? It's in the chat. I don't know, Karen.
Yeah, I'm looking at the question.
It's pretty.
The fact of the matter is that in the Senate, the only person who gets to decide what goes up for a vote is the majority leader. And so that's been a problem that we've had predating this administration, this Congress. But yeah, that was the issue that we saw even in 2017 with, having to continue to wait to see what they were going to put on the floor with the ACA repeals that included the Medicaid cuts. So that's just an unfortunate piece of how things are going. And we're going to, have to take a look at that. The fact of the matter is I'll be realistic, but then also end with a little bit of positivity. They're going to come back. I don't think it's likely that we're going to push them and remind them and frankly shame them and say you should be back and passing legislation instead of on vacation back at recess in your home states. But the reality is that they're going to be back in after Labor Day, and then there's going to have to be something that comes together on appropriations before September 30th. And we're assuming that this is also going to have to, the relief package will also come together on that time frame. So September is going to be hard push, and you're going to be hearing a lot from us and a lot from Leo and everybody. And then it's probably going to quiet down. And then depending on what happens on November 3rd and the weeks that follow, it is going to be most likely the most wild lame duck session we're ever going to see. And that could be good. It could be that we could see things like permanent extension of money follows a person, et cetera, come up because of those things are expiring at the end of November. So those kind of things are going to be out there. And frankly, the positive reception and understanding that we've seen based on the work that we did both in 2017 and what we've done in the past 8 months or however long it's been, 6 months, around COVID, the real understanding of HCBS and the real finally understanding of the institutional bias of the program is going to lead us to, in the new Congress, be able to see some really bills out there to make changes like making HCBS mandatory and that sort of thing. And so I say that to say, there's a lot of hardship that has gone on, but because of all the work that everybody's done, rising tides will lift everything. I really believe that, because of the conversations that we're having on the Hill. And I saw the question about the asset limits. That's something that, Bethany, our Director of Income Policy, continues to work on. I think that just like mandatory HCBS, asset limits, marriage penalties, we're going to see galvanization on those kind of issues because of the work that the community has done coming together. So that I can end on that positive note, Leo. How about that?
That sounds great. And it's really a hard time. It's a very hard time, and I think we need to be positive. I think there's a lot of good things that have happened in our community. And just to clarify too, when you mention continuing resolution, you're talking about funding government, just for everybody, because some people know what you mean when you say that, some people don't. So the government's there's got to be some action, is what Nicole's saying. They have to come together. And by the way, the House was on recess too, but they were all negotiating in leadership during all that time until the Senate called a recess. So just so if someone else says, no, the House was on recess, so what's the big deal? Well, there is a big deal if people,
and the House had already done their job. They already passed the third relief package.
Right.
So, yeah.
So, I mean, I just wanted folks to appreciate that. And because there is, unfortunately, information that comes out that's not always accurate. So, true. Never been this bad. Well, it hasn't been this bad in a long time. And you know what? We don't need the partisanship on anybody's side. We really need to come together. So
exactly. Was someone going to ask a question?
Yes, Nicole Jorwic. I was curious. You say that on both sides of the aisle, people are for HCBS, but do you have, maybe you covered this, but do you have any sense why the HEALS Act didn't include HCBS?
It was frankly cost. They were trying to do the skinniest bill possible. Okay. And so it was very limited in scope. And you can't, and please, Leo, feel free to share that comparison document with the group. It's meant for anybody, but that'll show you because it really clearly shows what the HEROES Act had and how much of that in the HEALS Act there's none. But yeah, so it was really just the scope of the bill.
So should we advocate for a separate bill just for HCBS maybe?
No, we should continue to advocate for them taking up the good parts of the HEROES Act, including Section 30103 that has the HCBS funding. Because separate bills we're not here. It's going to most likely be something big again. So unfortunately, that separate bills can sometimes confuse things.
Thank you.
All right. Nicole, thank you for joining us. I'm going to let you go. And I'm hoping you have a great few days or weeks in Chicago. You deserve it. And so we didn't get to see your brother this time, but next time when you come on, we'll see him again if you're in Chicago. So. Oh yeah,
he's right behind me. He can wave hi really quick.
Good.
Chris, can you say hi? That's everybody who doesn't know, that's my brother Chris, and he's the reason I do this.
There he is, chilling. Okay.
Yeah, exactly.
No wonder he didn't say hi.
And my nephew wants to say hi. Say hi.
Hi.
All right. Bye, everybody.
All right. Take care, Nicole. Bye-bye.
Bye-bye.
I'm going to take us back a few. So it's really a pleasure to have her, obviously, with us. And how, again, I can't emphasize how well we're aligned with the national and chapters across the country. So, well, the data, we're kind of come back to advocacy in a few minutes, because I use the word go in a distance because we talked among ourselves as volunteers and staff sometimes, and it just can seem wearing. Everyone, even if they're doing well, is worn, and so many of our friends and families are worn out, so we just need to put a little time into the advocacy always. And well, the testing, it's interesting. By the way, I see the raw data now, and there's actually two different numbers for testing. There's actually 1.8 million when you look at people who have been tested twice. So about 400,000 people have been tested twice. But in terms of the single testing, which is what I've been tracking for people for the first time, it's about 1.4 million. And that assumes that data is correct. There could be some thousands of people, right, retested in that number. So the testing's going really well. The lab results, if you need to get tested, what I want to give people a heads up on, and by the way, today we're going to cover one surprise topic of day financing we had planned to cover, because that came out Friday, emergency regulations, but we're also going to cover testing, surveillance testing that came out Friday. So, and we were waiting for that for a few weeks. So I'm going to try to squeeze that all in before the end of this 45 minutes. The total number of cases, it's almost the same number as last week. I think maybe it's like 1 or 2 lower. It's now 1,875 people. So we want to bring that number down. Obviously, we're still, we're okay, but not in great shape. We're in, obviously not in great shape. We want to be green. The number of people who died rose by 94. I don't think, that tells us a whole lot. That's more cumulative, which is helpful, but it's 5 less than last week. So we have seen 8,582 people die. I think on one of the webinars, maybe in September, I'm going to show, if you recall, those of you who have been listening to me, how shocked I was about how high. I knew nursing home deaths had been high, but I hadn't realized how much of the percentage it was. And I think what I want to do to show things in context is show deaths and virus positive cases in our world with congregate care versus nursing homes and other settings like that, and show what happened. And that'll probably be in September. And hopefully we won't have a surge in September. So we're very concerned that the numbers are still holding even on a higher rate with college students coming. I guess the next few weeks will be key. There were deaths in the last week. Again, I can't tell because it's less than 5. So if it's 1 death or 4 deaths, there are 22 active cases as of 8/11. So in the community, and the thing I want to tell you about staffing, just so you appreciate, in the purchase of service world, so private providers, most of whom are nonprofits, they have to build their staffing, their nursing, and all that based on the budgets they have. Okay, and every agency is different. We did a little bit of basic budgeting a few weeks ago, and I may get into this. This is a whole other level for educate people. But so what happens is, if you have a certain number of residences, you might be at a great place in terms of balancing your nursing staff and those kinds of costs. And then as you go to the next level, you may not be as good a place because now you've expanded by, let's say, 5 more homes or 6 more homes, and you have to, but you maybe don't have enough money, extra money for like another full-time nurse or a full-time and a half nurse, whatever makes sense. In the state-operated system, whether it's the institutions or it's the homes, congregate homes, they actually have positions assigned. So even during the day, how we had to worry about providers, and still do. They're staffing during the day right now in residential, but they don't have funding for it from the private providers. The state actually, in their programs, does have people scheduled 24 hours, okay? So there's certain built-in advantages. And when the virus first hit with the epidemic, the state was actively recruiting new nurses because as you may remember, Hogan, which has about 100 people living there, 50 people had the virus. Okay, so just to put things in context in the numbers, the larger the place is, the scarier. But so the state system versus the community system, there is an issue of equity in terms of the private providers. And usually what happens, the private providers, they have to figure it out. There's a tension between the state and the private provider folks that really shouldn't be there, but it's there because of this sort of inequity. So we face the facts. We got to do that already. I think and now we're going to go to talking about the virus surveillance and the day financing, so you guys can be up to date. And this all happened a few days ago on the 14th. So in terms of going the distance, and maybe we'll come back to this, we need to be proactive. We need to get the Commonwealth to be more proactive. I know they're under stress. I know there's a lot of uncertainty. So it's not about blaming anybody that they didn't cause the pandemic, but we need to do our job as an advocacy organization and as families, individuals coming together, and provider organizations that are invested in the advocacy. We need to work together to basically help the state be more proactive, tell them, get them feedback earlier. And so I think I can't say that enough, that's going to be an important piece of our work, especially if there's a surge, okay? And we're going to tell you about a meeting we had with the commissioner and her team around family issues recently. And as you know, we've been trying to champion that since March. And despite some of the progress made by the Commonwealth, there's more that needs to be done. And here's some of the issues that relate to that being proactive. Make sure there's an in-home option, which there is right now for those already getting services. But for those home from school, not necessarily, right? For those who may not be in a formal day program, not necessarily. Having obviously a program to go to if you can, and if medically appropriate, yes. And then we need virtual to fill the gaps, which we clearly know we have that. I don't think that's a concern to advocate for. Addressing turning 22, there's a lot of people. I want to encourage anyone on the call, if you know people that are struggling, whether they're turning 22 or they're 15 or they're 38, and they're in need and a family need to work through their family support provider, and or if that doesn't work out, go to the area office, call the service coordinator supervisor, go ask for the area director if that doesn't work. Do not stop. Do not give up. And again, persistence in advocacy, persistence in personal advocacy. And then you can always let us know if you've gone to the area director and nothing's been resolved, and we can help share that information. Carrie and Maura and Kathleen have done that. So, and it's something Carrie tries to stay on top of in her regular meetings with the chapter's family support directors. Develop a bridge to the future. That's really where we got to go. And, we had a number of sessions on self-direction. Carrie's going to have a session next week, maybe. We're still trying to figure out, if not soon after, around more personal services. Yep.
Hi, Leo. Yeah, Liz is coming on next week, so she'll be on next Tuesday.
So Liz Sandblum is coming on. She's okay, I know I'm going to screw this up. She's like the deputy assistant commissioner. How's that, right? For operations. And she is in charge of self-direction and related services. So that's great, Carrie. Thank you. And we're going to talk about that again. Offer other options that are personalized. It's not just shared living. There's a range of options that are personalized. That can be a choice against a full day program. And remember, your personalized options probably is not going to be full day unless you're able to match it with PCA and those kinds of things. And of course, technology is going to be important. And Charting the Life course, which we just had a meeting with the DDS team, twice, right? For new videos that are going to be developed to help teach individuals and families about Charting the Life course. So let's talk about the two most current events, both on the 14th. And I'm going to go quickly to allow time for questions and whatever. So a whole list of emergency regulations were filed. I have the link here, I'm pretty sure. And I can tell because for a change, I printed out my whole PowerPoint in advance. But basically these emergency regulations, no, I don't have the link here. So, okay, I'm going to have to add it. If people are interested, we can put it in the chat. Bottom line, we did not know what was going to happen for July even. Okay, so this is August 14th. The regulations were posted. This isn't new money. This is money that organizations could not bill because they could not have a full program because of social distancing, right? The 113 square foot rule. So that meant potentially places wouldn't open. And so that's why the day programs open slower. Some open by the middle of the month, others open later. And if they have to open by September 1st, if they're going to get funding through day habilitation. But the day habilitation retainer had been approved, as well as higher percentages in terms of being able to bill. There's a 40% factor rate built into the billing because, again, even if you bill 40%, you're probably not going to get 100% of your money. So whatever your rate is, plus 40% of that rate is the new billing temporarily, at least through October, potentially through November, unless your census goes up, right? Which we don't expect that that's going to happen. This regulation includes, review of all rates through November. And as I say in number 3, it's unlikely that most providers will meet full utilization. So basically, for July, you're going to get 50% of what you would have gotten. And then you can bill beyond that with an additional 40% factor in your rate. But August 1st, this month, that stopped, the retainer. Okay, the retainer just allows them to have enough resources to buy that PPE, to get the cleaning products. I mean, there's these machines that cut down on human sanitizing. They're anywhere from $750 to $1,500, and you might need 2 per site. There's machines that clean vans, okay, that There's static cleaners. I won't get into that. It's easy to Google it. If people are really interested, I can find the names. We have them in our computer files somewhere, and we can send you them. But these are the kinds of things agencies are investing in, let alone stuff for virtual programming. So that's the day. The good news is that saved some agencies from probably closing permanently. Okay, just so you know, day only agencies, day employment only agencies. And now it will help them to at least be open for up to 50% of the people. And it'll be a rare instance that'll go above 50%. And we're assuming that not till October, best case scenario, would there be higher than 45, 50% of people. And that assumes room in a building to do that. Or people coming 2 days a week, other people coming 2 days a week, that kind of, schedule. And some of you may already be experiencing that, and you're welcome to comment on that. And then the second thing I want to touch on is surveillance testing. Basically, that's the routine testing of asymptomatic individuals, all persons paid or unpaid, working or volunteering. And this goes across agencies, by the way. I'm sharing this with you as if it's DDS and mass health programs, but this cuts across DYS, which is Division of Youth Services, Department of Children and Families, you name it. Anyone, who in any way, so if Leo Sarkissian was going regularly to a few sites and actually intermingling in the program area or with the staff in the program area, I would have to get a baseline test by September 15th, and then be tested again if I was in a high transmission region every 2 weeks, starting on September 16th, okay? And basically, they will put out, I'm sure, another guidance in October on this, or late September, because based on surge or no surge. High transmission areas, those are places that you may know of already that are red, right? Red areas, or they have enough towns or cities that are in a red area that together they're classified as a high transmission area. They gave people till September 15th for the baseline. I think just to be reasonable because of this, when this is being released. It's a lot of people to cover. I think they were concerned about that. Hopefully the people's baseline will be done before that. And then the people that aren't included are obviously people on leave, right? They're on leave. They're not at the office. State employees don't have to do it. They have their own requirements. Or those who have tested positive already. Now there's an exception to that, which I'm going to tell you about right now. Low transmission areas, you're not in a surveillance mode. You just are in a baseline mode. So for those people, even if they were already tested, right, and recovered, those individuals who were tested positive and recovered X weeks ago, whenever, right, if they were developed clinically compatible symptoms, right, they have to be retested if they're more than 6 weeks past their release from isolation, okay? And then obviously, if it's detected, they have to be isolated and considered to be reinfected. Individuals who were previously diagnosed and who are identified as close contact with someone that's a confirmed case have to be also retested if they're 90 days. So 90 days versus 6 weeks. 6 weeks, if you show symptoms, 90 days, if you don't show symptoms, but you are working with someone you're in close contact. That's an interesting rule because essential workers previously did not have that requirement, right? Only if you showed symptoms. So this is good. This is good, and it's a real positive. And then the last thing I want to touch on, it's programmatic, and then I am going to try to tuck in some links for you. Is a meeting we had, and Carrie was with me at the meeting, so she can bug in if she wants for sure. And then I have the, of course, Don't Cut Us Out page. We met with DDS to discuss unserved and underserved individuals and families. We discussed various strategies. And this is why I really emphasize the encourage outreach to area directors. If you're in need, do not hold off. We need a broad dialogue. Carrie is working with DDS lead staff to coordinate virtual meetings. And then in the meantime, though, that second bullet relates to triage. We don't have to wait till the virtual meetings to encourage you and for us to encourage each other. Consider yourselves ambassadors on encouraging people to not be shy. if they're struggling, to please ask for further help. And I don't care what the situation is. And if distancing needs to continue, though, I want to share with you, I think we're going to hit a cliff in terms of funding of the day and employment programs and day habilitation. We're going to have some tough, it's not our decision, but I think the Commonwealth's going to have some tough decisions to make. That's going to have to be more nuanced because of people needing help at home, right? And all of that. And then we have to work together. We talked about working for a bridge to the future, whatever is done. So that's a chock full today. I could have saved some of that if we were meeting more than once, but just wanted to share that and maybe open it up in the last 10 minutes for any feedback or questions.
Yeah, lots of questions in the chat box.
I'm going to try to pull up when we do that.
Okay.
Links.
Yeah, so just, a couple questions about that, about the routine testing.
Yeah.
Does that apply to day program staff? And how about PCAs?
Thank you. What a great question. No, this is all related to Congress. The day program did have a requirement for people coming back. And there's guidance on that, and I can tuck that in there too. But this was in relation to residential care and residential, any kind of residential, congregate care, large care, you name it, any kind of residential.
Okay, so it doesn't apply to PCAs either.
Wow. I would be shocked if it applies to PCAs.
Okay.
That's still on the essential worker, the guidance on that. I'm pulling it up right now and I'll pull it up and share it, by the way. Let me do a new share because I do have it here. Here it is, surveilling testing guidance. It's not the right one. Are you guys seeing the guidance for surveillance testing? Or are you seeing my ad?
I do not see it.
Okay.
No.
It gave us the wrong thing. Stop share. Yeah, I hit that, but it gave me the wrong share. Yeah, here it is. Yeah, it keeps going to the wrong share. That's interesting. I don't get it. Let me see if I can pull it up another way. Yeah, it's not. All right. Sorry. I don't know why it does that. I have it.
Okay.
Oh, here it is. Can you see it now?
Yes.
And it says surveillance testing, right?
Yep.
Okay, so just quickly, if I pull down, no, it's really, yeah, I said mass health because I was thinking of day hab, and that's where I confused people. It's not. So it's residential, and PCA would be in, obviously, yeah, it's congregate care. So that would be really up between the PCA, right? And the person being served and or the family. So, and then if I can pull up the day guidance, I'm going to pull that up, okay? To show you that. Any other questions?
Yes. Hold on, let me try to get my chat open.
Actually, can I just
Okay.
for a second? I had put in the chat my my website because I have information on the home page of my website about self-direction, person-centered planning, and
Okay, you put it in the chat, Giassi?
yes.
So people can grab it. That's good. Thank you. Yeah, it's great.
Yeah, thanks, Jossie, for doing that. So Chris was wondering, is there any plan now for funding residential providers providing services to their residents during the day who are not in day programs due to space constraints and that sort of thing?
So in terms of right now, for people who can't go to day programs, you're allowed to bill remote also as a home visit. Is that what you're asking, Chris? Is that, it's not where we want it completely to be, because that's going to translate into maybe the equivalent of 4 hours to 6 hours a week. All right. And remember, here's the problem, because of the way day programs are funded. As I shared in one of the sort of budget pieces, where it's a 1 to 7 ratio in most cases, unless you have the, what do you call it, the wrap. Depending on the wrap situation, one of the things we're talking about in the future with DDS, if this continues, right, is figuring out a way we can translate the dollars on the day side, right, for supports either from the day program staff or in some other way for in-home support. If people are willing to take that. Some families don't even want the in-home support, which I think worries me in the cases where people are sort of over, just totally overwhelmed, right, with behavioral or medical needs that they're taking care of all the time. But I think Carrie and I talked about, and I think people heard it, about more flexibility, about the use of funding. And I know other folks have been sharing that with DDS as well. There's a group of families that met the commissioner to talk specifically about that, as you may know. So, and you may have even been involved in that meeting. So I do think that's going to happen more if this surge happens and that we're not able to get, if this continues for 6 months more, that it looks like it's going to continue. I think we have to have another strategy. Would that be fair?
I was actually thinking of the situation my son is in, who has residential services in a group home, and their day hab is, first of all, they're gradually coming back. So far, not that many folks, the day only people are back, but not many of the group home residents. And then eventually when they get more people back going to day hab, they will go every other week to the day hab. So I guess my question is, so then the agency has to have shifts of people in the residences covering those 6 hours a day.
Right.
But there's no additional funding for those shifts? I mean, how long can you sustain that?
That's being negotiated. Well, let's put it this way. No one wanted to talk about it. This is what I mean about more proactive action that we have to push.
Right.
It's on the table, right? And certain people in the Commonwealth recognize it's an expense, obviously. I have people that bring it up to me, you can imagine, every week, right? Who are paying for these services. No, that's a real problem. And I think, I think on some level, and the Commonwealth, they are so uncertain about their revenue that when they do something for day financing, they don't want to pull the trigger yet. They delay doing something about the residential, okay? And they're trying to take a triage, again, I'm avoiding attacking anyone on this stuff because I do feel it's confusing for them too. And that, I wish there had been the time for some of the people in HHS who didn't have the depth of experience that the secretary does, Mary Lou Sutters, to have really experienced more on the ground. So it would give them more comfort when recommendations are made. So for the day financing you just saw for July, Chris, it just came out on August 14th.
Right.
So this is the thing that makes it difficult. And that's why I explained about the state system. When it's state operated, geez, you need nurses, they recruit the nurses. It's sort of like, come on, folks. Well, they've already got these built-in expenses in the state budget for the staffing, right? So it's less onerous for them, but they don't really appreciate the implications of that unless they've experienced it on the ground. We try to remind, I think DDS does, but even at DDS, again, it's the whole hierarchy thing, how big a bureaucracy is, and what I originally talked about in March and April, the centralization of messaging, centralization of power. When it happens during a crisis, it has advantages, but it has distinct disadvantages. And that's what's happened here. They want to help spending be, they're trying to control their spending. They're trying to avoid going into a deep cliff themselves. So we have to advocate. We can't advocate enough during a period like this, but we also don't want to wear you guys out and people that are not like you who are leaders. You're a leader. You know what it means. You're part of the family here. There's other people who are we have to get them in for these intermittent hits. And we're trying to be careful. And sometimes maybe we're too careful. We need to be stronger. Like this is a great example of congregate residential funding that you raise. It's really, it's just sort of hanging in there, and it's August 17th,
And just how long can you sustain that just in terms of the cash flow?
Well, you know what it is, even separate from that, do you wonder about people's decision-making at the agencies? Right. Not hiring new staff. I mean, think about it, right? That's what I think about that stuff even more. Like, what are decisions already being made that they are forced to make, right? And I have a colleague who said to me, he has day and residential, and he said to me, I'm trying to decide. do I hire anymore for residential, or are my day staff going to keep working there? Right? Because if it's not full staffing, he can use still some of them in the residences. So he's not laying anybody off, but he's trying to figure out when he pulls the trigger on recruitment again. Others may not even be recruiting, right? So it's scary. It's he's better off because of fund balance and, you know, that kind of thing than some other nonprofits are. So, and then you're right. There's also what happens if you run out of your cash flow and you run out of your loan, whatever your, you know, that credit line is that you have, what happens then? And then what you can do, I mean, the good news is, and ADDP mostly plays this role as a trade. They would go and share with the commissioner who's in desperate straits, and then something may be done or not done in that situation. But I think we will get resources. I think it's just, you know, 6 weeks into it, you know, that because July 1st, right, was when the money stopped. Any other things, Carrie?
Thanks, Leo.
Yeah, there's a comment about transition age kids, and just, you know, is this message getting out there? You know, kids in late stages of transition are not getting any transition services in schools, and any indications that they'll ever get them.
So I just tackled the adult service part of that in that list, and you're right. And we've been working with SPAN and Federation, you know, on those issues. And there's other groups like MAC as well, of course, and other groups that are working on these issues. You know, there's 300 something cities and towns. And if we ever need more people coordinated, probably this is now, between people with disabilities who need hands-on, right, education in full virtual towns, which I don't know what it's up to now because unions are refusing to go to work, right? And I get it, the scare of physical illness. So I think we got both the transition issues where people aren't going to get the prep they need. And then deeper than that, we have latency age kids, and right, you can imagine the challenges they're going to face in terms of regression or lack of education. So, and it's something we share with typical students, right? I think if I agree, it's the best thing I can say right now. And how do we galvanize more people by maybe area? Maybe that makes sense, right? Figure out a leadership strategy by area. I don't know if people have recommendations to us to coalesce with the other groups we're working with to figure this out. I do think we're probably under advocating here and how to get there with the resources we have. We're open. Any feedback you have, and Carrie and I would love to take it. And it's something we've talked about with our staff team, Maura, Carrie, Kathleen Amaral is a school board member in her city, and Ellen's on maternity leave. Charlie Fisk, we've all talked about this stuff, and I think we don't talk about it enough, and we just need more bandwidth. And we're over time. Anything really jumping out at you, Carrie? Because I don't want to keep, you know.
Just Christine was wondering if you could put the testing guidance for day programs link in the chat, please.
I will. You know what I might do is actually give it to you before you send out the PDF. Does that make sense? And you could, there's a slide. I'll send you one slide.
Okay.
Then you can add it to the slide. You're turning into a PDF that I gave you the link to.
Yeah, I can do that.
They'll have links. And if we can find the day link too, because someone asked about that, right? And the testing, sure. Christine just asked about the surveillance testing. I'll put that in there too.
Yep.
Because I might have just sent, by the way, Christine, your boss has it too, by the way. I'm kidding. I know who Christine is. I'm just saying they got it over the weekend. But I'm happy to send it. We'll make sure that's attached, that link as well. Actually, how complicated is it, Carrie, if I give you the actual products?
It's no big deal. I can certainly just send those along with the PowerPoint as well.
Files, and if I can, the third file, if it's not that big, for the day reopening guidance, which is we've done before. If I can give you the link for the day, I don't think as many people want the day reopening. I'll try to give you at least a link to that. All right, and we'll do that right now. We'll do that. Okay. All right.
Okay, great.
Carrie, should I send you will you send my website? Because around the homepage, I have information about self-direction, about.
Awesome. Yeah. Well, you send me, actually, I've been on your website, so I'll just include your website link.
Okay.
For people who wanted more information on self-direction.
Terry, I just grabbed it. I'll include it with the other ones. Okay.
So
okay.
Well, this would also be good for the person talking about self-direction. I can't go into the chat because I'm injured.
Yeah.
Um,
Oh, I didn't see that before. I see it now.
oh, I fell a couple weeks ago and I fractured my foot and I have a torn ligament in my hand or something.
Oh, no.
And so
Oh,
I'm trying not to use it, but a good topic would be to get for people to give more thought on how to direct people that are on the PDP and self-direction, because we have people coming into our homes that we hire, and like I have a person who has a family, has kids that are college age, and she's telling me that she's going to visit her kids once they go back to school, and I'm thinking, well, is that good? Is that a good idea for her to be coming to me after she visits her kids?
Right.
And stuff like that. And what should I tell her? And so maybe there are some guidelines that they can come up with or something like that.
Well, is a person coming to your house being tested on a regular basis?
I don't know.
I'm going to let Carrie keep doing this. I have to get off only because I have a meeting, believe it or not. So I'm going to get off for me. But go ahead. Keep going, guys.
So maybe there could be some type of guidelines for people that are self-directing and the people they hire, what they can and can't do, or when they should be tested before they come into our house if they're taking care of their families that are and visiting people that are on college campuses. And
sure.
like
That's a good, that's a good thought. And, maybe we can have a discussion about that. Also, just not people who do self-direction, but families, anybody who has people come into your home, own personal home. What's some good guidance on that? So thank you. That's a great idea. We'll work on getting that together.
Okay, thank you.
Any other questions or thoughts on that? Or I guess I'll let you go then. Thanks all for joining us, and we'll see you next week. All righty. Tomorrow I have anybody whose kids are headed off to college who are on the autism spectrum. I do have a woman from Easterfield coming and talking about the College Navigator program. There's openings in that, and they do some support for people with autism who are entering college or in college on how to navigate campuses and do well in school and that sort of thing. So anyways, great to have you join us. Thank you so much. Everybody have a wonderful day.
Thanks, you too.
Thank you.